Right.
Hi, everyone. Welcome to the Hormone Boot Camp. And today we're talking to Dr. Mache about the thyroid. Hi, Dr. Mache.
Hi, Rena. How are you?
Good. So many of us women end up having thyroid issues. And of course, it's a cascade, right? Your thyroid gets weak and suddenly there's all these other symptoms that pop up. Talk a little bit about why does the thyroid get affected so badly during menopause or even perimenopause?
Well, the thyroid is a very important gland. Let's just drop back one moment and just say, what does the thyroid do? And it's a gland responsible for metabolism, basically, how fast your body is sort of revved up. And it's located on your neck, kind of the shape of a bow tie or a butterfly. And it is a very, very important gland and basically affects every cell in your body. But there's a lot of changes that happen at the time of menopause and perimenopause. There's a lot of hormonal changes, and those changes in hormones also affect the thyroid. It also turns out that at that time of life, there's also more susceptibility to autoimmune diseases. There's sort of a rise in women in terms of the likelihood of getting autoimmune diseases, just meaning that the cells of the body, the antibodies in the body, have the capacity to attack cells in your body, the normal cells, and hormone cells, producing cells, of which the thyroid is one of the glands that is a big target for that. So it's very common, actually, in other times when there's big hormonal imbalances, like pregnancy and puberty, also are times when thyroid is more likely to have a problem, but particularly in that perimenopause and menopause window.
Excuse me. And it's unfortunate that just at the time when you need your body to function as well as it can, it sort of starts to do things in a more exaggerated way or sort of starts to get ultra sensitive. So talk a little bit about the symptoms that our listeners and our boot camp members can listen to and start to identify, maybe a checklist of here's the symptoms, and if you've got these, then be aware that your thyroid may not be functioning optimally.
Right. Well, let me just say that the thyroid can have a problem in one of two different ways. It can be overactive,
Okay.
in which case your metabolism is revved up. So you feel anxious and you may have diarrhea and you may have outbursts and mood outbursts and a whole host of other things. So it could be that it's overactive. That's much less common, particularly in women, because in the window around perimenopause and menopause, there's this huge tendency towards underactive thyroid. And there it's kind of confusing. It's very interesting that right around menopause, thyroid disease, perimenopause, menopause, and diabetes all seem to cluster together.
Yes.
But the thyroid disease, though, it can be a sluggishness or fatigue, or you might get kind of foggy thinking or brain fog or feel cold or may start gaining weight, or you may have memory lapses or, changes in your emotions. And that may sound a lot like perimenopause or menopause, and it could be. But those two things are superimposed on each other and come together, so it just amplifies the feeling of just being totally out of balance and makes the symptoms that are there at this level, with the two of them, they're, off the charts. So really, when you start to feel that something is wrong, that your mood is out of whack, that your metabolism's out of whack, that you don't feel right, your brain is not, working the way you're accustomed to, that's the time to check for some kind of hormonal imbalance and talk about it with your healthcare provider.
So hair loss is a big one, and I know so many of my friends,
yes, it is,
myself, have experienced the trauma of sort of losing half our hair. And
the hair can thin out a lot, and it gets not as bright, and it gets more brittle, particularly with low thyroid. It doesn't seem to, you can just brush the heck out of it and you just won't get any luster.
Absolutely.
It doesn't feel the same.
And they used to say hair is dead. I'm like, no, it's not.
No, hair's not
It is not dead. It is so alive because as I started adding some Dulce flakes, just regular flakes to my food, I started to notice a difference in my hair. So let's talk about what are some of the recommendations in terms of testing, because one of the challenges I experienced is even when you do get testing done, the ranges that are clinically established may not be indicative of the fact that in your body that range is still out of order, meaning my numbers were in range, yet my symptoms were pretty clear that my thyroid was not functioning correctly. So let's start with, first of all, what are the tests that you recommend and what are the ranges that women should look out for?
Well, let's talk a little bit for just a moment about how the thyroid works, and then it will help you understand which test to get. So in general, many hormone glands work because the pituitary gland, located somewhere right about there in the brain, the base of the brain, secretes a hormone, in this case called TSH, or thyroid stimulating hormone. The TSH will then stimulate your thyroid gland to make hormones T3 and T4. And T3 and T4 are produced, and when they get back in the bloodstream, they come back to the thyroid and say, okay, we have enough, and they balance each other like a thermostat. Mm-hmm. So if you think about it, if your thyroid stops working, your TSH will kind of talk louder to your thyroid to try and get it to make a hormone, and it will get higher and higher and higher, in a way, quote, speaking louder to the thyroid. So when a thyroid is low, then TSH tends to be high. When thyroid is overactive and there's tons of T3 and T4 coming out, it suppresses TSH, and then TSH will be low. I hope that makes sense to you. There are exceptions to this depending on what's going on, but that's the general rule. So here's where everybody gets messed up on the values. Generally, the most economical way to test for this is to get a blood test for TSH, thyroid stimulating hormone. But what happens is when they were first making these values of what's normal and what's not, there are a lot of people when their thyroid first starts to get underactive, where the thyroid is still working normally, but the TSH is talking a little louder to make the thyroid work harder and make normal amounts of T3 and T4. So your bloodstream has the right amount of T3 and T4, which is the hormones you need for metabolism, but your TSH rises. I hope that makes sense. And so what happens is when they were making the normal range, initially, they snuck in a few people who had underactive thyroid in that whole group.
Oh.
And so as a result, the ranges of TSH that were normal were this high. They were wider than they could have been. So it used to be that a test used to be somewhere between 0.5 and 5, or even in some labs 8 for a TSH. We now know, of course, that 8 is definitely elevated, 5 is probably elevated, and if you really have strict criteria, which is more and more used today, the TSH is usually around 0.5 to 2 or 2.5. So it's much lower than it was just not that many years ago, and that has screwed up, if you will, how people think the value of that implies a TSH. So usually, when thyroid is low initially, TSH is up, and but T3 and T4 are normal. And then as the thyroid gets less functional, the TSH is up and T3 and T4 get low. And if you want to be sure, particularly early on, if you have a problem, then you also get antibody testing to see if there's an autoimmune problem, because the Hashimoto's thyroiditis, which is the name given for the autoimmune hypothyroid, is the most common of the thyroids that women get, particularly around perimenopause and menopause. And so when you get that, you'll check for thyroid peroxidase, TPO, and a thyroglobulin or an antithyroglobulin, so a TG or antithyroglobulin. So these TPO and TG tests are often done, and when those are present as positive, that means your body is making antibodies. So no matter what the thyroid numbers are showing,
Right.
that process is in the works in your body, and in time, you will have a worsening hypothyroid. And it's a way to kind of be more thorough in the earlier stages to know you got it or you don't.
Right. And then you have to keep monitoring, right? Because perimenopause, menopause is such a time of change that just because at one moment in time your thyroid was a certain way doesn't mean it's going to be the same 3 or even 6 months later. So how often do you recommend, if women are having symptoms, how frequently should they get tested?
Well, you have to see that the symptoms, you know, thyroid used to be thought, or low thyroid or thyroid problems for perimenopause and so forth, used to be perceived as present in about maybe 1 to 3% of women. It was definitely common, not rare, but not prevalent. But now with these new criteria and more evaluation with these antibodies, we're finding that it's present in as many as 13 to 20% of women. It's not rare at all. It's quite common. So to answer your question, it really depends that you know that the symptoms are not due to something else. As I said, diabetes could be it, perimenopause and menopause, but you have to always be vigilant. If the symptoms persist, or you find you're getting tired, your hair is changing, you know, you're starting to have changes in your thought processes, and any of a weakness getting out of a chair because your muscles and your thighs get weak. When these kinds of things happen,
I mean, weight gain is a big one too, as I understand.
I'm sorry?
Weight gain is a big one too, as I
Weight gain, yes, because metabolism is slow, and when you don't metabolize as much, it just kind of layers on.
Yeah.
And so, absolutely. So I think that when you get to the point that you're approaching menopause and nothing else is specifically pushing you, it's a reasonable test to check at your annual test. If you're on thyroid medication, you know, it might be checked more often to make sure things are not changing, because once you go on thyroid medication, your internal thermostat is not working. You're kind of putting in an external thing by the pills you take. And also, you know, many women, or some women, will go on hormones. They could be on birth control pills, or they could be on hormone therapy of some kind. If they are, I mention it because if you do take estrogen, then it will change the amount of thyroid you need and actually cause you to need more thyroid. And that's not a problem.
Right.
It happens because the estrogen stimulates a protein that binds more of the thyroid, so it's not available to work in your body, and you just give a little more thyroid and it solves the problem. You just be mindful of it, and that's all there is to it. It's your body responding naturally to what to the external input.
So if someone has figured out that they do have a thyroid that's functioning out of range, let's say, what do you recommend? How can they bring it back into range?
Well, I mean, of course, medications do it, but if it's an autoimmune problem, particularly, I'll mention, because these are very commonly the most common problem you're likely to face. But first of all, there are certain nutrients that are important. Checking your thiamine levels, checking your magnesium levels. These are, normal minerals that you can check. Selenium levels is another one. Sometimes people are low in these, so that's useful. And also, some people who have different kinds of allergies will also be affected. Food allergies, for instance, dairy or gluten, for some people soy. Eliminating that from the diet may actually be helpful in lowering the how bad the thyroid problem is, if it's the Hashimoto's type of thyroid. So you just get those out of the way, and then you can see if you get better. But all of that will affect your inflammation in your intestinal tract and can cause some of these antibodies to form. So you can try your supplements that I mentioned, the selenium, the thiamine, the magnesium, and take a little bit more of that. Like typical dosages are like an extra 200 milligrams of selenium and an extra 200 milligrams of magnesium, for instance, as an amount. And then you take the thyroid medications as needed, and then you check, in about 3 months or 2 months time to see that the levels are where you want. One thing you'll notice is if you have a low thyroid and your hair is falling out and you replace the thyroid medication, or it becomes replaced by your behavior or your habits or your food intake, etc., you won't see this. Hair is a cyclical thing in terms of growth. It takes about 3 months for a cycle of hair to start growing. So if you start taking the thyroid, you're not the next day going to have thicker hair. It's going to take about 3 months before you can actually see something happen as a result of replacement. So if you're patient, it will happen. It just takes a while. And of course, watching the water boil always takes forever when you're, watching something that you want to happen, but it will happen.
And there's an anticipation too. Did it grow? Did it grow? I have grown back a bunch of my hair, so I am happy to say that it does come back. I also want to point out there was a few other symptoms. So apparently bowel movements also linked. Constipation is linked to thyroid imbalance.
Yes, it is. It slows down the movement. The reason you have bowel movements is the food goes into your esophagus and it gets digested and you absorb the food and the waste is left, and your intestines are just kind of they're squeezing in rhythm, pushing it down. And when the metabolism slows, the bowels slow with it and stuff just backs up.
Exactly. And so ladies, if your first symptom is just that you are now starting to have more constipation, then I would say it doesn't hurt to buy a kelp salt or kelp flakes from Amazon for like $7 and start adding some more kelp flakes and see if it helps at all. I mean, I'm a big proponent of using whatever's naturally available to give our body that additional boost it might need, especially during these fun 30, 40, age group that we experience these wonderful symptoms. So that would be my one suggestion too, is that constipation, weight gain, hair loss, wrinkles, all the fun things that they tell us it's because of aging. It's not, we don't age overnight, because that's what happened to me. It was like,
you can feel like it though. You can feel like you age overnight when that happens.
Yeah, exactly. And it's crazy, right? That something as little as a little thyroid functioning a little slower can overnight age you. But the good news is that if you nutritionally support yourself, and by the way, you do have to rest, exactly like Dr. Mache said. There's a lifestyle change that's required as well to get the thyroid to function well again. And we're going to create a list, by the way, ladies, of all of this information. So there's like a little checklist for you that you can go through, both in terms of symptoms as well as some suggestions that you can implement pretty easily.
Rest is good, sleep is good, stress reduction is good. All of these things that your lifestyle that can just not make your body as demanding. It's kind of, why tax something that's taxed? We don't have the reserves for that. So there's a lot that you can do.
I love what you just said about not taxing it. I think that's actually the secret to getting out of this hormonal imbalance intact, is realizing you're going through a time period when your body's going to need a lot of extra love and attention, and giving it that extra love and attention. And that's what our boot camp's all about, right? Sauna, self-massages, acupuncture, reflexology, candles, magnesium salt baths. It's all about pampering yourself. I mean, how can life get any better? So I always say, grab this time frame with both hands and take advantage of it the way you did when you were pregnant.
TLC, thyroid loving care.
I like that. Thyroid loving care. I love that. So any tips in terms of if someone's completely messed up and they're being told you have to take medication, so they're going to take medication, what do they need to watch out for?
Well, you can medicate yourself until the other side. You know, if you have too little thyroid and you take too much medication, you can make yourself hyperthyroid, which will start to really, you'll be really jacked up. When that happens, you know, you'll just be angry and revved up and just agitated, and you can really move yourself the other way if you're not, if you get too much. But if you're being followed, that shouldn't happen. And if you have hyperthyroid and you don't get enough, then you get the other way and you have all the symptoms we've been talking about. So it's really about the balance of that hormone. And because you don't have the thermostat working back and forth between your thyroid, your TSH and your thyroid, then you've got to have blood testing periodically to make sure the levels are in the right range. But generally, you're going to be able to tell by how you feel. In general, you will. But people, like when you go into the doctor's office, they may test your reflexes. They may just take one of those percussion hammers and hit your reflexes here or your knee. And if your thyroid's low, it'll be sluggish. And if your thyroid's fast, it'll just bang up. You know, it's really remarkable. It's just like, it's as though you have the accelerator in your car all the way down when you're revving it up. It's just really turning your body's engine on.
Very interesting. All right. Well, this has been very insightful, Dr. Mache. Any parting tips?
No, other than to say that if you don't feel right, if your mind's not working the way you think, your body's not working you think, just take that as information that you want to share with someone, one of your healthcare providers, and make sure if it's your thyroid or it's perimenopause or whatever it is, but people should feel pretty much the same and well all the time. And if they don't, well, then check it out.
That sounds great. Thank you so much. And for the rest of you, tune into all these other great videos that we've been doing for you. Hope you're having a great time on the bootcamp. Stay smiling. We'll see you on our next bootcamp video.
Take care.